quite
because
normal.
a lot of the time people use sleep use the bed for many things, and when actually strictly it's only for two things. Yeah, so
Two things.
Sleep and something else. Wink. Having trouble sleeping? You might be suffering from insomnia, and it's more common than you think. It is estimated that about 1/3 of the adult population will experience insomnia symptoms at any given time. And about 10% of them will be having symptoms so severe that it's considered a fully-fledged disorder. So in celebration of World Sleep Day, we'll be answering some commonly asked questions about insomnia. Today, we have with us Dr. Seng. Hello!
hi.
So, Dr. Seng, just to start off, maybe let's answer this big question that everyone has. What exactly is insomnia?
So patients with insomnia actually report dissatisfaction in the quality and the quantity of the sleep associated with one or more of the following: difficulty initiating sleep, difficulty maintaining sleep with frequent awakenings, early morning awakening with inability to go back to sleep, and that causes a lot of distress and social occupational problem and functioning. And then insomnia episodes actually occur for at least 3 times a week and for at least 3 months.
So sometimes if I feel a little restless and I can't sleep, or I get a bit stressed, I wake up, it's not considered insomnia, right?
It's just occasional and may not fulfill the criteria. It may not be a disorder.
So everyone around me seems to be having some kind of issue sleeping. How common is insomnia in Singapore?
Insomnia is a common sleep disorder in Singapore. A local study actually found about 15.3% having insomnia, and a local study also found that 13.7% of the older adults aged 60 and above actually have experienced insomnia.
So there's quite a lot of people that may be experiencing insomnia in their life. What causes insomnia then?
Well, insomnia is usually related to things like stress, life events, or poor sleeping habits.
Yeah, then are there any risk factors in terms of like developing insomnia in your lifetime?
And also maybe people with medical problems, people with chronic pain, cancer, heart disease, gastroesophageal reflux, or hyperthyroidism, or even obstructive sleep apnea. These patients may be of high risk of having insomnia. Mental health conditions, depression, anxiety also puts one at risk. And in fact, early morning awakening can be actually a sign of depression. Other causes also include coffee, tea, cola, caffeinated drinks, alcohol, and smoking as well. Alcohol can also sort of affect the deeper stages of sleep and causes interrupted sleep.
Oops. So actually I hear a lot of different things over the internet about how many hours of sleep each person needs. So what is the recommended amount of sleep per day?
It is recommended that adults get about 7 to 8 hours of sleep. And sometimes the elderly may actually get sleep less, I think partly because of the aging process, and I think sometimes they do sort of expend less energy, they rest more, and hence they actually require less sleep at night.
Yeah, actually I'm not gonna lie, I sleep about 5 hours a day. Is there any problem with that?
That's not enough. So patients with insomnia, and if it's sort of it may lead to complications because sleep is very important for health, and it is important for normal brain function. And I think people with insomnia actually report poorer quality of life.
So the next question, and I believe it's something that all of us are guilty of, does excessive screen time cause insomnia?
Yeah, certainly, especially nowadays, a lot of people work from home or even home-based learning, or people continue to play games or use the internet. Sometimes the overstimulation and fatigue can also affect sleep. And also the blue light from screens can also suppress melatonin production, and which is something essential to help us sleep.
You heard the doctor? Put down your phone and go to sleep. who can I go to address my insomnia?
You can go to a family physician first, and then who actually take a history on sleeping habits, and also on looking for medical issues that actually may affect insomnia. There may be a need to do some blood tests, like a thyroid function test, or if obstructive sleep apnea is suspected, a referral for a sleep study may be done. And of course, treatment will involve actually addressing the stress or any medical issues or any mental health conditions. And sometimes there may be a need to refer to a psychiatrist, and who actually may even recommend to see a psychologist for cognitive behavioral therapy.
Cognitive behavioral therapy. What does that entail?
Okay, it involves challenging negative thinking or worries about sleep. There are people who worry so much that they have difficulty sleeping. And in CBT, there's also learning about what are the good sleep hygiene practices and some of the behaviors to avoid. These behaviors affect ability to sleep. Strategies may be used such as progressive muscle relaxation and deep breathing techniques.
But that sounds like a long time. So what if I just have some issues sleeping and I just wanted to get something to make me fall asleep? Is there anything for me?
So medications can be considered, and these include antihistamines and melatonin. Doctors generally will sort of advise not to take prescription kind of sleeping pills for more than a few weeks, because these may have side effects like grogginess. It can actually increase the risk of falls, affect memory, and cause addiction if taken in the long term.
So actually I hear you talk a lot about good sleeping habits. What does that mean?
So it involves good sleep hygiene practices. So I think first we need a very conducive sleep environment. So preferably the room is cool, quiet and dark. And use the bedroom for sleep only. There are people who actually eat on the bed, play games on the bed and do many other things. So the bed is strictly for sleep. And it is important to have regular sort of sleep time and wake up time, which must be consistent during the days and over the weekends. There are people who actually sleep extremely late during the weekend. We should avoid long naps. Okay? If you want to nap, maybe 1 hour and not more than that. And also avoid heavy meals. If you eat too near your bedtime, there are people who may get gastric reflux, and that will affect the sleep. And also avoid drinking too much water, because that prevents you from having to keep waking up to urinate. It's good to get regular exercise, but again, not to exercise too near your sleep time, because the overstimulation actually may make a person more awake. Avoid smoking, alcohol, and limit caffeinated drinks only in the daytime, in the morning.
Yeah, I think I try my best to do all those, especially the more obvious ones like not taking caffeine. But I think sometimes when I just lie down and go to bed, when I close my eyes, all I see is like my work and I just can't fall asleep. Is there any way I can help for that?
You may want to consider relaxing bedtime routines. For example, before you sleep, have a warm bath, calming music, light reading, deep breathing, progressive muscle relaxation or meditation to help you wind down.
Thank you, Dr. Seng, for being here today to answer all our questions about insomnia. I hope that everyone has learned something interesting and it can help you sleep better. Happy World Sleep Day, everybody! So remember to like, share and subscribe for better sleep ahead. You, go to sleep.